asked, what is the procedure if I want to go a little bit bigger? Or my implants are just a little bit too big, what's the procedure if I want to go a little bit smaller? It can be a little bit different depending on saline versus silicone, but generally speaking, a size change can be pretty easy. If you're happy with the shape of your breasts, you just want them a little bit bigger, most of the time we can go in under local anesthetic and pull out the intact implant and put a little bit bigger one in, or maybe a little bit smaller one in. If the implants have been in a long time, if they're saline, we know they're not ruptured because they're still inflated, but with silicone, they could be ruptured. So you have to take those cases on an individual basis. And so I would recommend having a conversation with a board certified plastic surgeon if you've got older implants, and try to decide what's best for you. But with implants that have been placed in the last, 2 to 10 years, oftentimes an implant exchange can be done under a local anesthetic. It's pretty low downtime. If you're significantly downsizing or significantly upsizing, you may need to go to sleep so that the pocket can be manipulated, or if you're downsizing, maybe you might need a lift at the same time. So we take each patient individually. I would say think real carefully about your size beforehand so that you don't want to knowingly have to change your implants down the line. So generally speaking, it can be pretty simple.